Welcome, everyone. So great to see you. Inviting us all to take a collective breath here, all the rushing and planning to get here. Let's just breathe together for a moment. It's no small feat to carve out the time to be here, and I want to acknowledge the efforts that we've all made, especially our guests. Thank you so much, Cynda, for joining us here in the heart of the continent. This has been a long time coming, and so I'm really honored to welcome you all. For those of you who don't know me or don't recognize my new look, my name is Dawn McDonald, and I'm the Director of Strategic Initiatives at the Catholic Health Corporation of Manitoba. I invite you to actually look around and see each other for a moment. These people who have gathered together with the calling of the heart, our colleagues on the path, and honoring those who can't be here and trusting in the ripples that will unfold from this visit. Let's take a moment here to acknowledge that we are actually gathered on the original lands of the Anishinaabe, the Cree, the Oji-Cree, the Dakota, and the Dene people, and the homeland of the Métis Nation. We recognize the treaties that were made on these territories and acknowledge the harms and mistakes of the past. We are all treaty people, and we hope that our presence here today and our interest in a more loving and compassionate world may somehow contribute to a spirit of reconciliation and true collaboration. On behalf of the Catholic Health Corporation, we welcome all of you, including those who are joining us by telehealth. Hello, whoever you might be, wherever you are. It's so great to see these events come to fruition. Compassion Grand Mounds are made to be spaces to explore the co-creation. So you're responsible too. The co-creation for the conditions for compassion and innovation to flourish in us, among us, and in the very fabric of our organizations. Thank you for the service that you offer in our communities. Everyone contributes to this vision. It's an honor to welcome a world-leading pioneer in the area of moral resilience. We've spent a number of years talking about moral distress, and I just love this shift that we're beginning to recognize that we can actually nurture our ability to be fully human, fully here, and contribute to our own resilience as well as to the resilience of our organizations. Dr. Rushton, as you see, is the Anne and George Bunting Professor of Clinical Ethics in the Berman Institute of Bioethics and the School of Nursing at Johns Hopkins. More than that, you've become a trusted friend, and we're so grateful that you're here. Her writings aim to transform current approaches for addressing moral distress by focusing on innovative methods to cultivate resilience and to design a culture in healthcare that supports ethical practice at all levels of the organization. We're so happy to welcome you.
So it's really an honor to be here with you and to, a lot of times when you come to places, you're invited to be sort of an expert, but I'm not really an expert in anything much other than I've been in the cauldron for a long time trying to figure out some of the ways that we can really create environments within ourselves and within our institutions where we can be whole and where we can actually create the kind of outcomes that really matter. So I'm going to share with you what I've learned so far, and it is truly a work in progress. I have been, I often like to say, wallowing around in this for a really long time, personally and professionally. And so I thank you for being here. And as Dawn said, this is a co-creation. So hopefully something that we discover together today will nourish something that you'll do after this. So to start, I'd like to invite everyone to remember why you're here. It's really easy in the complexity of everything that we're doing that we lose track of why we're really here. And it's important as we explore this territory to have that as an anchor, whatever that is for you, because from that place of purpose and that place of our fundamental grounding, creativity can emerge. And solutions that we might not recognize can also be understood. So I want to start with a case, and this is a case based on real facts, but obviously protecting the privacy of the people involved. This is a case involving Justin. He's a 27-year-old construction worker. He had a spinal fracture about 3 years ago, and initially was treated with opioids, and when the prescription ran out, his physician refused to renew it. He began using heroin as an alternative and developed endocarditis. Often he would come back to the hospital. His infection was not treated effectively, and so he was in and out of the hospital over and over again. He was recently readmitted to the hospital this time with fever and positive blood cultures, and he's on IV antibiotics to treat his infection. He was referred to outpatient rehabilitation. He's had multiple relapses. The staff who is involved with him are very invested in his recovery. He has agreed to outpatient referral. And today, following a visit from one of his many friends, the nurse caring for him finds him in the bathroom, nodding off, after apparent use of illicit drugs. So, notice your responses to this story. Notice what comes up for you, how your body responds to just hearing the story of Justin. What happens? What do you start noticing? Anybody feel tense anywhere?
There could have been, if I could talk from personal experience, there could have been maybe, first of all, construction work is very, very hard. That's number one. Number two, was there a safety measure in that particular city or province like we have? Number three, he might have hurt himself indirectly. The x-ray might have shown, as you say, multiple fractures. We have trouble here in this province too with home care, with physio. Did he receive the right treatment with home care? Unfortunately, did he become unrealistic, like addicted to some medications?
Right.
There are some medications, it doesn't make a difference if they're for pain or not. Certain medications, as you know as a nurse and PhD, that can be addictive.
Right.
So was his choice personal or not personal that he became a drug addict?
So all of the narrative that we have around a story like Justin, right, is a reflection of our own bias, our own filters, our ways of thinking about these kinds of situations. And if we pay attention, our bodies are usually going to tell us, there's something here that feels somewhat out of alignment with our values, with how we think the healthcare system ought to work, how we can work with this reality of a person who now is in a situation where both has probably a psychological dependence, but also a physical dependence, and now a biologic problem in terms of infection in their bodies. So just noticing what our responses might be. So for example, some people might approach his case by getting angry and frustrated at him or the system or each other. Why can't we fix this? We might also become kind of numbed out. It happens so frequently. We can't fix it. We feel helpless and powerless, and we give up. How do we engage in a situation like this? Or we might actually turn away from Justin and say, you know, we've tried everything we can, and it's up to you now. So if we think about our responses, it's an opportunity to notice the patterns. And one of the patterns in situations like this is that we can become morally outraged. We can become morally outraged at the situation itself. We can become morally outraged at the system. How is it that the system perhaps has contributed to this kind of an outcome? And often when moral outrage shows up, it indicates to us that there is an important value that is being challenged in one way or another. And often it ignites negative responses. So moral outrage in and of itself is not a bad thing, because what it does is it alerts us, it sort of puts the flag up and says something important is at stake here. But the question is how do we actually use our moral outrage in a way that produces constructive outcomes, that leads us to identify opportunities that may not be visible when our nervous systems are sort of dysregulated and we are likely reacting from our most primitive part of our brain. So this question in Justin's case is what is really at stake here? Why is it that it produces this kind of response in us? Well, part of it is that we care about values like respect for Justin as a person, for families, for each other. It is honoring his dignity. Is he making a volitional choice in how he is responding to his own situation? How we balance the obligations for patient well-being and avoiding harm. And as clinicians, I think we often struggle in cases like Justin's and many others. Are we doing more harm than good? And how do we then make sense out of in the various ways that we might be participating in creating the conditions for this kind of experience to continue? Everywhere in these situations, there are questions about justice and fairness. Justice from the point of view of, are we treating him in the same way we would be treating other people who had a slightly different narrative or story around their circumstance? Does it matter? How do we allocate our scarce resources? How do we decide where we're going to invest in our healthcare system, in what programs, and to what end? So the bottom line in most of these circumstances is the question of integrity. What does that mean for Justin? What does it mean for his family? What does it mean for the people taking care of him? What does it mean for the organization who is providing care? And importantly, who we are as a society. So often in these cases, we experience what's been called a moral residue. And it's interesting because even when we do the right thing, there are often obligations that are unmet. So we could say, let's prioritize his physical well-being and let's invest in minimizing the harms. But when we do that, there are other obligations that aren't met. And what's interesting to me, I've been doing clinical ethics consultation for, close to 30 years. And I think there's this idea that when we do the right thing, that we're going to feel great. Not always. Not always, because what happens is, even when we prioritize one of those values over another, that obligation still remains. And that may create a kind of residue for us. It can also happen when we experience moral distress and we allow our values and our integrity to be compromised. So that residue, the leftover, after we've actually engaged in a process of discerning what would be the right thing. When we are out of integrity, we suffer. And as someone who has dedicated my career to serving others, we often don't turn toward our own suffering. That we too are suffering in a whole variety of ways as we try to provide care for others, whether it's at the boardroom, whether it is in the point of care. There's a kind of suffering that emerges. So one of the things I've been working with for a long time is this idea of how do we think about moral suffering? And I have often asked myself, the chicken and the egg question. Is it the moral distress that causes moral suffering? How are they related? And where I currently am is I think that moral suffering is the umbrella term, that moral distress is a particular type of moral suffering. But it's the anguish that we experience in response to moral harms, failures, or unrelieved moral stress. And if you think about the moral dimensions of suffering, often it's triggered by witnessing, participating in, or actually causing harm, either intentionally or unintentionally, to others. And in some way, imperils our sense of integrity as a person. So for me, that's the umbrella, and moral distress as a particular type of suffering. And as Dawn mentioned, we have 3 decades of research. Much of it started in nursing that focuses on this experience of moral distress. Moral distress is that sense of anguish in response to a situation where 3 things are present. First of all, we recognize there's a moral problem. In Justin's case, there are multiple moral problems. Second of all, and I think the place where this distress really becomes prominent is the sense of I have responsibility to do something about this. Third, we reason and deliberate about what would be the ethically justified thing to do in this case. But because of either our internal or external constraints, we can't act on it. So it's that gap between what I think I should do and what I'm actually doing that undermines our sense of integrity. So in the nursing literature, and increasingly now we are recognizing that moral distress occurs in other disciplines, medicine, respiratory therapy, pharmacy. Some of the causes are familiar to us. I don't know your system as well as I do mine, but at the top of the list for many people has to do with how we take care of dying people. Issues around causing harm by using overly aggressive treatments, being asked to provide therapies that we think have more harm than good, where we may call it futile or medically ineffective. The likelihood of producing good outcomes is very, very small. We may not value the opportunity or chance for that small outcome, but the people we serve are asking for it. We also see a very prominent theme around communication, and communication about goals of care, about what treatment options are possible, how patient choices are either honored or disregarded, whether we provide fully informed consent to the therapies that we offer. And a theme that has begun to emerge that was not present in the early studies is the question about incompetent or unprofessional, unsafe care. Watching others who are practicing in ways that actually harm our patients. This one, interprofessional conflict, has been a theme in all of the studies. How we are as teams, how we actually work together, how we honor each other's points of view. And the last one here, these last two, have to do with an issue that I'm pretty sure you're struggling with in your system as we are, which is the allocation of scarce resources, including all of our frontline clinicians, our technological resources, our beds, our expertise, our time, our attention. And in our context, one of the sources is providing less than optimal care due to pressures from administrators or insurers. Now, your system's a little different than ours. But when we feel like we are providing care that actually is not consistent with what either the evidence suggests or we know to be the appropriate treatment, and how that leaves us feeling this sense of despair. We know that moral distress is associated with burnout, and the levels of burnout in our clinicians is rising at an exponential rate. It is negatively correlated with the kind of workplace climate where we work. Nurses, not unexpectedly, have higher levels of moral distress than often our physician colleagues, have different sources of moral distress. And in nurses, it's inversely related to years of experience. So sometimes it's a cumulative process of these kinds of situations building up over many years. So as Dawn mentioned, I had the opportunity several years ago, after spending a lot of my career focusing on moral distress, I asked myself the question, well, what's the alternative? What else is possible instead of only focusing on this distress? So I had an opportunity to pause and look at all the evidence and the data, and I started seeing this term, moral resilience, and I thought, oh, great, what's that? Well, there wasn't a lot of meat on the bones. There was maybe about 16 articles where it was actually mentioned. We did this extensive review of the literature. And so I thought, okay, well, let's see if we can figure out what that is. So I want you to think for a moment about a situation where you thought viewed yourself as being morally resilient. That kind of situation where you were confronted with a challenge, an ethical challenge, and think about what enabled you to have integrity in that circumstance. What were the inner resources that you drew on? What were the external supports that helped you to be able to navigate that situation? Not to end up depleted and depressed and despairing, but allowed you to feel whole. So I want you just to kind of imagine that situation. And what's interesting is that most of us remember the morally distressing situations, right? You can tell me all the details about those, right? What I want you to try to shift to is noticing the moments of integrity. Because that's where the information that we need to amplify lives. Our nervous systems are oriented toward the negative. We remember in exquisite detail those situations. Barbara Fredrickson's work is really clear. We need 3 positives to overcome 1 negative. So I want you to just really see if you can tap into that place in yourself, just for a moment. What is it that allows us to stand firm in the midst of chaos? So this is the working definition that we're using in our work. It's the capacity of an individual to preserve or restore integrity in response to moral adversity. And that moral adversity can take many, many forms. What's important to distinguish here is I'm not talking about kumbaya.
No, that's right.
I'm not talking about complacency, where we overlook ethical violations, or we make, a bad situation seem okay. It's quite the opposite. Moral resilience is the stance we take, the way that we are able to harness our values, our courage, our sense of purpose toward addressing the issues directly. So I want to make clear that this is not that squishy place where we really are, in a way, engaging in a shared delusion about what's really going on. We did some further work. We solicited definitions from 184 clinicians about what moral resilience meant to them. And these are the 6 themes that came from that qualitative research. Interesting, and in a way not surprising, integrity, personal and relational integrity, was the most prominent theme in all of their definitions. The sub-themes were around buoyancy, self-regulation and self-awareness, moral efficacy, seeing ourselves as capable and competent, and self-stewardship. So I'm just going to share a little bit about each of these and see what resonates with you. So when you look at the literature, most of the literature is focused on personal integrity. That sense of wholeness, of harmony, of being undiminished, and really being your values, not just talking about them, but actually embodying them in everything that we do. It requires us sometimes to do what is difficult, even when there's personal risk. Sometimes it requires us to really have to confront our own fear to do the right thing. The second part is this very important dimension of our role as professionals, which is relational integrity. And this theme came through very strongly. It was the sense of being able to acknowledge our interconnectedness with each other and the way that we can engage as a whole person by knowing myself, but also honoring the diversity of perspectives in my relational context. So this is a very interesting and I think rich area for further examination. What does that mean? So on the one hand, in a relational context, think about what happens in our clinical work. When we're working with someone who is acting with integrity, we resonate with that. And the likelihood is we are going to pull ourselves toward being able to be whole as well. The converse is also true. When we're working with people who are complacent, who are acting contrary to either their own personal values, our professional values in your system, your mission, we also resonate with those. So our interconnectedness is not inconsequential because our personal values are negotiated in relationship. That's where the rubber hits the road. So Kaz Tanahashi, who is a Japanese translator, I was doing some work in Japan, and I'm just using my usual vocabulary. I'm talking about integrity. And the translators kept saying, well, we don't have a way to translate that into Japanese. And I was like, oh. So they kept asking me, what does it mean? What does it mean? And I tried explaining. So I said to Kaz, help me to translate this. What does it mean? This was his translation. This is the Japanese character for integrity. And his interpretation of it is whole oneness. Now think about that. All of our integrity is intertwined with everyone else. We're not separate from each other. And that insight gave me a way to think about, wow, this matters how we show up. It matters how we are with one another. And that we have the opportunity to shift our experience by just how we are, individually and together. The other part of integrity is noticing when we're vulnerable to lapses of integrity. That's the self-knowledge of knowing myself. When we get alienated from our values and our convictions. When our conscience is ignored. I've been doing work with neuroscientists for a number of years now, and we started thinking about what were the preconditions for moral and ethical discernment. One of the strong elements in the preconscious state is the somatic activation that occurs in our bodies first when we detect an occasion for moral action, where our values potentially might be threatened. You know that place. When your conscience exerts itself, where does that start? Where does it start for you? In the gut, right? There's a reason for that. Our nervous system is constantly scanning for threats. One of the places where it can alert us is in our guts. So being aware of those signals and how we respond to them is very important. Because what we also know is that if we habitually override those signals, it will take more effort for them to get our attention. So when we constantly override that signal, oh, I'm just being overreactive, or I'm, it's really not my problem, or I don't need to be paying attention to that right now, those signals can become dampened. Sometimes what happens is we rationalize our behavior when we have actually compromised our values. And we begin to dismiss and normalize things that should not be normalized. It's a big issue right now. Am I looking away? Or am I looking at the problem straight in the face? Often, one of the things that makes us vulnerable is when we're exhausted. And many of us are exhausted. So that in and of itself creates an environment where we have to discern what is the proper response to these threats to our integrity. Sometimes the appropriate response is to compromise, not in ways that are mindless or are uninformed, but sometimes there are compromises that can produce constructive outcomes. Sometimes the appropriate response is to bring our voice into the conversation, to name the problem, not just as a managerial problem like staffing, but to name the moral problem, which is about staffing is a proxy for how we allocate our resources. And it has to do with balancing the benefits and burdens of the choices that we make, how it might imperil safety or quality. So sometimes our voice needs to be brought into the situation. Sometimes what we need to do is to say no, to refuse to participate in things that actually violate the core of who we are and our values. And to do that often requires courage and perseverance and a moral community to stand with us. Another response to these imperiled integrity is sometimes we need to bring the issues to the attention of the public. That is a response that has to be taken seriously and very carefully considered because the risks are high. That decision ought to be considered from a place of stability rather than reaction, because when we are in a place of reaction and our amygdala is in charge, we're likely to look back and say, that was not appropriate. So we've got to be really clear about what we're choosing in those circumstances. And the last one that many of us struggle with is sometimes we need to leave where we are to find a place where we can actually be in integrity. And there's many factors that go into that. But it may in fact be a reflection of integrity to say, this is not a good fit for me. To be in a situation where my values and my purpose are threatened with regularity. The next one is about buoyancy. And I love this term because buoyancy, like bamboo, suggests, right? We've got deep roots. We've got that wonderful buoyancy above the ground that the weather, the wind, the storms, the snow doesn't knock us down. We come right back up, right? It's kind of an uplifting sort of space to be in. My colleague Lori Leach, who's a clinical psychologist, talks about this as the resilient zone. And what she suggests is we want to try to stay in this zone of resilience where we're actually able to navigate, let go, keep moving without a lot of cost to ourselves. What we also know is that there are situations that bump us out of our resilient zone. These morally distressing situations may be those things. And we can respond in two different directions. Hyper arousal, where we often see behaviors of, sort of hypervigilant, anxiety, irritability, maybe even pain and nightmares. Or we end up on the hypoarousal end of the spectrum, where we basically shut down, we become depressed, we become depleted, we are sort of numb. Both of those are dysregulated. And so what we want to be able to do is to figure out how do we keep ourselves in that resilient zone. Well, one of the ways, and you obviously have great resources here around self-regulation and self-awareness. So this interplay between ethical practice and mindful awareness are not separate from one another. So that idea of we can actually pay attention to what's happening in the moment without judging ourselves, which I have to say is probably the hardest part of all of this, right? Because we are really good at that. And to do that in service of self-understanding and wisdom. So having the neural pathways that help us to pause, to reorient when we've been bumped out of our resilient zone is absolutely essential for ethical decision making. This quote by Susan Sontag, "The nature of moral judgments depends on our capacity for paying attention. A capacity that inevitably has its limits, but whose limits can be stretched." So, how does this relate to moral distress? One of the elements of ethical competence is moral sensitivity, being able to locate what matters in a situation. So we go back to Justin. What is it that we locate in that story that is relevant to how we ought to think about his situation and the choices that are present in responding to him? So what do we pay attention to? How can we hone our attention so that we are paying attention to the whole picture and not just one tiny part of the story? The next one is moral efficacy. This idea that we believe we are capable of responding to these circumstances, that we can exercise our moral agency either individually or collectively, and that we can do that in a way that is grounded in particular skills that we can use to discern and understand what is relevant from a moral and ethical point of view, that we can discern and use what we typically associate with ethical decision-making is the cognitive dimensions of that process. I'd like to propose that that is only part of the puzzle. If we're only focusing on reasoning, we have missed a big piece of our moral ecosystem. We have to be able to enlarge that to include how we actually embody these values and how they're showing up and what we pay attention to and how we facilitate the discernment process from a place of mental and emotional stability. That often will lead to a choice in terms of behavior or action. So, in the end, what we're aiming toward here is the ability to align our values, our behaviors, our choices, what we actually do or do not do in a principled way that preserves integrity. And sometimes the hardest thing is not the analysis. It's actually the step that comes next. How do we enact our ethical values? How do we do that in a way that reflects who we really are? And that requires courage, over and over and over again, to address the obstacles and the resistance that may come up.
I just want to take one picture.
Okay.
Thank you very much.
You're very welcome. When we find ourselves in these situations where we have to implement tough choices, sometimes we really are surprised when resistance shows up. Have any of you experienced that? Where you think, I don't know why everybody isn't clapping and cheering about this. This is the great response. I have to say, in my experience, that doesn't happen that often. Usually what happens is all the reasons why this is a bad idea, right? And all kinds of behaviors that sort of are aimed at preventing whatever it is that you're proposing from happening. That's the place where we have to go back to, why am I here, and how do I work with that skillfully rather than with the sharp knife, right? Sometimes we feel like that. But also the courage that is needed to be able to enact those decisions. So the last piece in our framework here is about self-stewardship. You can't give what you don't have. And part of our challenge in healthcare right now is we have people who are dedicated to providing care to others who are so depleted, their cup is empty. So this goes hand in hand with how we actually steward our own personal resources. That involves actually a commitment to know ourselves intimately. And what that means is to know what is needed to manage and allocate our resources, to know our limits, and to be able to say, I can't go beyond this because the cost is too great for me, for my team, for my patients, for my organization. And to honor that, to be compassionate toward our own limitations. I've been working in healthcare for a really long time, and I have to say, we are, most of us are dedicated to providing compassionate care to those we serve, but we're not very compassionate toward ourselves. we are so hard on ourselves. We expect ourselves to go beyond what is humanly possible routinely. I have nurse colleagues who never take a break in a 12-hour shift. How is it that we expect ourselves to go in heroic ways as a matter of course? How do we choose things that actually nourish our well-being so we can come back tomorrow and start again? So, on that note, I think it's important for us to realize that cultivating individual capacities are absolutely necessary. Avis Donabedian talks about system awareness and system design are important for health professionals, but are not enough. They are enabling mechanisms. It's the ethical dimension of individuals that is essential to the system's success. Now, let me tell you what I mean by that. It's a both-and proposition here. We can spend a lot of time developing these individual capacities, but until we have systems that are dedicated to fostering on a regular basis the integrity of the people in the system, we will not create a culture of ethical practice. So we have got to do the work of our cultures are full of people. We want them to be morally resilient. They need particular skills and cultivation. But we also must take seriously how we create the environment for that to flourish. So we've got to do both, and we've got to do both simultaneously. So one of the pieces we're working on is how do we actually harness our shared values so that we can detect the patterns in our behaviors, in our teams, in our organizations, in our culture that create the conditions for integrity to flourish. What is in the way? So I'll give you an example. We looked in our own organization at what were some of the patterns. Well, one of the patterns has to do with how we provide care at the end of life. You saw all the factors that go into moral distress. That was a pattern that was at the system level. How do we have conversations in a proactive way with people about their preferences? How do we involve resources like palliative care early on in the process? How do we facilitate communication among our teams? Those are the kinds of system levers that are necessary to begin to create the environment where those issues don't come up as frequently because we've designed a system to address them. So we've got to do this both-and work. And that's a whole other methodology that needs to be applied to our work. What we tend to do is we see, oh, you know, people are struggling out there, so let's just do an educational program on communication. It doesn't work, right? It's a partial solution. You spend a lot of money on it, and the results are not sustainable. So we've got to shift the way that we think about these issues, and we've got to ask new questions. We've got to engage in a new process of discovering how we can actually create the results that our system is designed for. The system results are a reflection of our design. And we have to move to a different paradigm that actually leads from the inside out, where our values and our purpose are the anchor for everything that we do Whether you're in the boardroom, whether you're at the front line, whether you are a person who is a support to the entire organization. That kind of alignment is what it will take for us to create this kind of environment. And every one of us is responsible for contributing to it. It is not just the responsibility of our leaders. It is all of our responsibility. So as we end our time together, before we have time for a few questions, I want you to consider what unique contribution will you make to that culture? What is it that you have within your scope of authority to shift? How will you show up differently? How will you engage in a new conversation? How will you embody your values? Because until we all take it seriously, we're moving the chairs around on the Titanic. Right? We've been doing that for a long time. And it seems that right now in our world, we are all being called to integrity. We are being called to stand up, to speak out, to actually take action that reflects who we really are. So, we're all in this together. And I think what we have to leverage is the seeds of integrity in all of us and our resilience, and to harness it toward not what we wish for, but for the future that we're actually creating together. That's where our power is. And I look around this room and I have a feeling that this is a rich resource here to be a model for all of us in how we might align all of those aspects of ourselves to create a model for others to learn from. So, thank you very much.
Whew, wow. Joseph, are there any questions from telehealth before we start? One. Doesn't look like it. I invite anyone who has a question to come to the mic.
Hi, thanks so much for that awesome talk. I do have one question about how we can help each other in understanding, in moral distress, I guess. I don't know my words, but the word that kept coming to me is validating people's feelings. And how, I don't know if there's any research about that. You know, people will come in obviously distress, but people deny them that by not validating their feelings, and you can often hear that when people are angry or upset, and for sure it comes in systems that we're not validating. So I don't know if there's stuff that you've talked about.
It's a great question. Parker Palmer talks about the human soul does not want to be fixed. It wants to be seen. And I think that is true in the midst of our suffering. We have a tendency, and I think it's because it makes us uncomfortable when somebody comes and is sharing their suffering and distress with us. We don't want it. So we have a tendency to dismiss it. And that's the kind of message that causes that suffering to accumulate. So we have to find places where we can bear witness to each other's experience in a way that is compassionate, is open, is kind. Not to fix it, but to acknowledge it. So some of the things that we do is we have ethics rounds where we create a space where people can talk about the hard cases together. Not for the purpose of we're going to come and give you the answer, but we're going to work with it together. And be able to acknowledge what's hard. But I also think there's another piece, and that's about how we can reframe what's hard to shine a light on what is actually good. Because we all talked about this a minute ago. We focus on the hard thing. And it's there, and what else is also true. So doing that often requires particular skills, and I suspect, I don't know this, but I bet your spiritual care colleagues probably, probably have some of those skills. And in my own institution, I partner a lot with those colleagues because all of these circles are overlapping. Spiritual care, ethics, our clinical work, they're all really the same. But we need people who can facilitate that in a way that actually embodies that sense of non-judgment and openness, because people need to know they've been heard. Does that help? Yeah. The other thing we do is we often do debriefings after we've had a really difficult case to create a space for people to make sense out of what happened. And I think that also nourishes people's sense of connection to each other and also validates that I'm not alone. Anything else?
We have time for one more.
Hi, I really appreciate what you had to say today, all the more so that I am a nurse, theologian, and I currently am teaching ethics to nursing students, and the most difficult part I have, because I'm also a Christian, is finding language to find common ground to deal with ethical issues that are common to all of humanity. And in this, I have two particular things that come to mind. I remember having a group of students having to choose a current ethical dilemma in society, and one of them saying, okay, class, who's in favor of medical assistance in dying? Raise your hand. And I thought, what part of this have they not understood, like the whole process? But also, as a clinician, having had times where, and I'm referring here to your first comments when you started, is the moral sense of something imperative in you being denied because you feel you can't, for instance, fully inform someone who is going towards abortion. And you know that your clinician self wants to be kind and compassionate and not hurt or wound, and that love, beneficence, but at the same time you have this screaming moral imperative inside of you saying something like, please have a look again at that life you're carrying. And I know a lot of us here are torn because we're A, clinicians, and B, have strong values, whether they be Judeo-Christian or Buddhist or whatever. And so those are some of the issues that I'm dealing with.
I appreciate the question.
About 6
I'm not sure I have the answer, but I have something to think about. And it has to do with the intersection of our personal values and our professional role. And I think one piece of work that is necessary is for us to discern and consider, how do I bring myself fully into my work when my professional role may have different priorities and values than I have personally? So is there a way for me to see my participation not as an abandonment of my core values, but an acknowledgement of what my professional role requires of me? Can I find a way to make sense of that in a different way that doesn't pit them either or, right? Because what happens is we perceive that if I participate, that suggests I agree with it. Not necessarily. And that's the piece of inner work I think we have to do is how do I understand those parts of myself? And how do I find peace with those choices? For some people, it will be that I can never reconcile that. And I have to remove myself from situations where that issue is called into question. For other people who have the same deep values, I have heard them talk about their ability not to just compartmentalize, but to make peace with those dissonant parts of the work that we've chosen. And that is not an easy path. It's really not. And yet, I think we're all being called to really examine that and to see, is there an enlargement of our compassion that is infused in how we have those conversations, to invite people to continue to stay in the process of discernment by supporting them and listening to them and honoring their point of view and their struggle may be the best we can do in that situation. Thank you. What?
Well, Cynda, thank you again. I say a good thought leader inspires and provokes us, and that no growth occurs without some destruction. So I actually hope that you've been scratched at a little bit today. I would be remiss if I didn't thank our sister leader predecessors who have founded this organization and continue to inspire us in all that we do at the Compassion Project. We thank those of you who are here in our good company and those who have gone before us. I thank as well all of our teachers and the teachers of our teachers and all of those who have brought us here in this moment. Thank you once again, Cynda, for coming to the heart of the continent, and thank you all for being part of this dialogue today. I just also want to remind you that there are still spaces tonight. Cynda is going to offer some of her training and warm conversations around how we bring grace to our relationships. That's tonight at the Cathedral, 7 p.m. in the basement. We welcome you there. Thank you so much.